blowing the whistle. So let's talk about who blew the whistle. Yeah. I don't know how many of you know it. It's an ophthalmologist who actually blew the whistle. That is, he exposed the world to this COVID-19 virus, or what we call as a coronavirus. He was the first one to tell the world, I mean, not just tell the world, he told people in a WhatsApp group, if you know, of medical doctors working in Wuhan Central Hospital on December 30, 2019. So it was actually an ophthalmologist called Wen Liang. So he was the first one who said there are a couple of patients that he had seen who had symptoms similar to the SARS virus. So he was the one who, exposed this whole so-called conspiracy of this corona virus, or what we call as the COVID-19. Okay, so this happened on December 30, 2019. He was all of 33 years old. He was an ophthalmologist. So see, ophthalmologists see a lot of things. Okay, they are very, very observant people. So he blew the whistle, and then on 22nd Jan 2020, so this so-called national expert of pneumonia, okay, in China. So he was a Chinese national expert on pneumonia. One doctor called Guangfo. So he developed conjunctivitis. Now, why I'm telling you the story is, what is the most common manifestation of this COVID-19 in the eye? It's conjunctivitis. So conjunctivitis, they say the prevalence ranges somewhere between 5% to sometimes a little around 35%. Okay, so now conjunctivitis. So that was our guy who exposed it. He was an ophthalmologist, Wen Liang, on December 30, 2019. Okay, when we had no idea about coronavirus at all. And then Jan 22nd, Guangfo contracted conjunctivitis, okay, which is the most common ocular manifestation of COVID-19. And what about this conjunctivitis? What does the patient experience? So there's usually a bilateral redness, and there's chemosis. So when I say chemosis, there's going to be a lot of edema of the conjunctiva, and because of the viral infection, patients have this pre-auricular lymphadenopathy. And when you invert the lid, there's a lot of follicular reaction. And this follicular reaction is typically in the tarsal conjunctiva, in the palpebral conjunctiva, but just beneath the tarsal area. Okay, so it is a follicular reaction that's seen, and they have a lot of watering, and it's self-limited. Okay, so now let's see how this conjunctivitis occurs. So you all know that there is this ACE2 receptor that is present on the conjunctiva and the cornea. It's present on at the limbus. Okay, so but for the virus to attach to this what is that called, this ACE2 receptor, you need another protein, a serine protease, what they call as TNPRSS. There are conflicting research findings about this. Some papers say it's present in the conjunctival and corneal epithelial cells. Some studies say it is not there. So how does the virus affect the conjunctiva? So one is, they say it's direct inoculation. But for direct inoculation, then those studies that disprove the presence of this receptor, this serine protease, okay, this protein, then it doesn't really make sense. Number two, from the upper respiratory tract, where you have both this serine protease as well as the ACE2 receptor, there is a backflow, and through the nose and the nasolacrimal duct, and from the puncta it comes to the conjunctiva. That's another theory, a postulation. Okay, and number three, how it infects the conjunctiva is via the hematogenous route. So hematogenous route, so it infects the lacrimal gland and is secreted in the tears, because there are a lot of viral nucleotides that have been identified from the tears, from the tear secretion. So yes, that postulation also makes sense. All right, so these are the three ways that the conjunctiva gets affected. Okay, so it's a follicular type of conjunctiva. As I told you, it's usually bilateral, and patient has burning sensation. Like recently somebody told me they have a burning sensation achanak se, but that particular person did not reveal to me that the person was COVID positive. I was just wondering all possible causes of dry eye, but eventually after some time I realized that the patient was COVID positive and achanak se had burning sensation. So must have been a conjunctivitis. Okay. So now coming back to our Li Wenliang, what happened to Dr. Li Wenliang? So even before the WHO could declare it as a pandemic. When did the WHO declare it as a pandemic? Once again, let me just look up this date. I'd written it and kept. Yeah, it declared it on March 11. Okay, it declared it on March 11. WHO declared it as a pandemic, but way before that, Dr. Li Wenliang was dead. Okay, so on 7th February, he was dead. He exposed the COVID-19 and he was dead. Okay, so we really need to appreciate ophthalmologists. So don't take ophthalmologists lightly or for granted. They are really exceptional people. So what I wanted to tell you, so December 30 he blew the whistle. Okay, that means he called the bluff. And Jan 22 there was this pneumonia expert of China who contracted conjunctivitis. And then February 7th, our guy passed away, Dr. Li Wenliang, and March 11th, WHO declared it as a pandemic. Okay, so I guess these are important milestones that you need to know. And just about conjunctivitis, I wanted to talk in this video. Okay, so yes. So in the tear samples, the viral nucleotides have been identified. In the conjunctival swabs, it has been identified. Okay, now coming to the TMPRSS, there are conflicting studies whether it's present or not present. But yes, definitely the ACE2 receptors are definitely present. And something else, new thing. Now that means we have an ocular RAS system. Okay, so if there is an ACE2 receptor here, so that means we have something like a renin angiotensin system in the eye. So this is something new which has been in the research for developing anti-glaucoma drugs. Isn't that new? Isn't that sounding interesting? So we'll talk about this on another video. All right. So this was just a short intro for you on the ophthalmologist who blew the whistle. I don't know. My Gorkas just stopped whistling ever since I started the video. Okay, guys. So see you for today. And what else? So keep studying. Bye. Any doubts? Just put it down in the comments. Okay.